Polycystic ovarian syndrome. I want to give you all some of my meandering, wondering thoughts on this as it's becoming more common, and there's a lot more we can do for these well. So, also known as Stein-Leventhal syndrome, PCOS was something that when I first started my career, it wasn't super common. We were trained about it, super rare, wanted to evaluate it. I feel like these days, most of the young ladies I'm seeing have some form of polycystic ovarian syndrome. So first of all, what is this? It's actually a form of metabolic syndrome. So which deal with insulin resistance and just energy production problems. That's basically what metabolic syndrome deals with, is people having problems making energy. Why are we seeing this more? Well, it's almost, one is toxicity. Generation to generation, we're seeing more people have issues with chemicals and toxins in their body. And that's just from NHANES data that has been collected by the government every 5 to 10 years. They just kind of evaluate the population, look for disease states, look for chemicals, and they just are tracking this. The government does a lot of stuff. Between the EPA and different organizations, they actually do a really good job of tracking stuff. It's just they don't really do a whole lot with it. So this is one cause of seeing more of the PCOS. The other thing is, as we're seeing more diabetes, insulin resistance, they go hand in hand, particularly in younger women with PCOS. So that it's exploding. I remember I was doing my training 1996 to 98. I was told I'd never see a pediatric patient with type 2 diabetes. And by 2000, I was diagnosing my first case. And now, depending on what you read, maybe 10 to 15% of kids have some type of type 2 diabetes. Up to 60% of the population is insulin resistant. So it's a big deal. And that's part of this blowing up of PCOS and autoimmunity. PCOS is an autoimmune syndrome spectrum disorder. And so as we see autoimmunity or inflammation go up, particularly if you experience these things early on in your hormonal life cycle, PCOS tends to be an issue of younger women versus older women. So these are three major causes of increase in polycystic ovarian syndrome. So how's this impacting people? One, fertility. It has a massive impact on fertility. And strangely enough, one of the common treatments for PCOS is birth control pills, which actually make some of the parts of PCOS worse. Part of the PCOS is excessive amounts of male hormones or androgens. And guess what? Birth control pills actually suppress that. It can cause actually estrogen or androgen deficiency, which it's interesting. The external vaginal vault is estrogen dependent tissues is well enough that you'll see vaginal issues, et cetera. Other treatment options, that are conventional, that actually we do use a lot in the functional medicine world, are metformin. But again, what's metformin doing? It's actually treating insulin resistance, which we can do with diet. And we'll talk about that in a second. The other thing that can be really super helpful with PCOS is actually using low-dose naltrexone. That helps with inflammation. It also helps regulate your immune system. And actually, we use that with a lot of autoimmune issues, of which then PCOS is an autoimmune spectrum disorder. So just using a little bit of metformin, a little bit of low-dose naltrexone can have a massive impact on young ladies with PCOS. But these are treating symptoms, not the root cause. The root cause has to do with these environmental toxins and chemicals. So you have to work on detoxification. And the gut microbiome, so you have to work on your gut. So sometimes the quick fix for PCOS, while you're kind of waiting through things, is to start maybe a little bit of low-dose naltrexone, a little bit of metformin, which most physicians these days can start without any major issues. And then to work on the gut microbiome, whether you do some advanced testing or you just do a basic gut protocol. And then working on your overall inflammation and detoxification, which again is a big driver for PCOS. But we're seeing more of it. It's becoming more common, more dominant in our culture. There are some herbal remedies that can help with insulin resistance and PCOS, like berberine. There are different calming herbs, cortisol calming herbs, that can help lower the cortisol effects seen in PCOS. But you really need to have a really good detoxification protocol, working on your liver and your gut, anti-inflammatory protocol, which all these things require a massive change in your diet, removing inflammatory foods, removing processed foods they're all kind of bacteria in your gut that can drive autoimmune issues. But PCOS is becoming more common. We're seeing a lot more, and it's something that's going to impact fertility in the future. So if you're having any symptoms of PCOS, painful periods, painful cycles, ovarian cysts, abnormal hair growth, chin, nipples, other parts of your body, then you probably should consider getting an evaluation for PCOS. And if you're dealing with it, then really hop on, especially if you're younger, because you can literally reverse the trajectory of your health by addressing that.